What's up?
I just gotta talk to you about this assessment real quick. It's called the Test of Everyday Attention. T for short. Basically, this is a standardized assessment that measures various types of attention. There's selective attention, sustained attention, divided attention, and attention switching. And it's common for people who have neurological insults because they have attention deficits.
So who even gets this test anyway?
So basically, it's adults 18 to 80 years old, and it helps people or assesses people with mental illness such as schizophrenia. We got dementia patients, we got Asperger's syndrome, and CVA.
So what does this test include?
So basically, it takes 45 to 60 minutes to administer, and it includes visual and auditory tasks, including a map search. It's elevator counting with and without distractions. It's a telephone search tasks also, and then also auditory and visual elevator counting to wrap it all up. This test is quite expensive. It costs $353. And it comes with a manual, administration booklet, you got your stimulus cards and maps. Comes with a lot of stuff. But it doesn't come with a stopwatch, so you gotta bring your own stopwatch to. The raw scores are converted to the scale scores, which are then compared to the normative scores. And basically, it's not an overall score of attention. Each different type of attention that I described to you earlier are all separately scored. So then the person initiating or giving the test knows what type of attention their patient needs to work on. Correct?
Yeah. So is this test even worth it?
Is it worth it? Is it worth it? Strength of the T is easy to administer. It assesses different types of attention, obviously, like I just said. It's seen to be valid. The retest reliability, amazing for post-CVA patients. And lastly, it's preferred over global cognitive assessments because it is better to assess the occupational performance and functional disability of individuals. Yeah.
So what you're saying is, there's nothing bad about this test.
Yeah, there is. So basically, it's expensive. People who have visual and auditory deficits may score poorly on this test. So it might be seen as them having problems with attention, but they really don't. Also, the materials might be outdated because the test is a little old.
So what does this help the therapist with?
So basically, the therapist can interpret the scores and assess the individual to see if they even need intervention to assess their attention deficits. And then they can do it to record their progress and see if they're making any progress throughout the intervention plan. And lastly, it can work with employees' abilities to assess their attention, see if they have any deficits in the workplace, because that's serious. And then can also work to construct and work rehab program. Wrap it all up, we need to talk about the domains that it assesses in the occupational therapy practice framework. So basically, we got our client factors, so our body functions, our hearing and visual functions. It assesses attention, so they need to use their attention, it's in the name, and perception. And then we got, we got our performance skills. So they need to use their motor skills to point. To point to various things while doing the task. And then lastly, we got our process skills. So listen, can I have your number? Can I have it? Can I have it? Can I have
I just don't give my number out to strangers.
Oh, I see.
What?
It's because you're feisty because you got that updo going. Girl, I got one thing to say about that. Own that ponytail, work that updo.